Assalamu alaikum. Now I would like to talk about the second part of the ethics, which is management of AMA discharges. What is AMA? Against medical advice. So, management of AMA discharges investigate or at risk for leaving, financial reason involve social worker, substance withdrawal, offer medication assisted treatment, and care delay dissatisfaction. Apologize for unmet expectations. Ensure or document patient's informed refusal. Determine that determine that patient has the capacity for medical decision making, understand benefits of staying and risk of leaving, communicates reasoned basis for refusing treatment, document informed refusal in chart including signed AMA form, and provide best possible alternative treatment, offer appropriate treatment or prescription, offer assistance for follow-up care, offer to resume treatment at any time. Confidentiality limitations to confidentiality, that is limitations to adolescent confidentiality and include the determination of imminent risk, suicidality, homicidality, and threats to safety, sexual abusive relationship, intoxicated driving. Additional risks to confidentiality should also be discussed with adolescent patient, including guardian access to information through the electronic medical record and patient's portal, direct medical record requests, and insurance billing statements. When confidentiality must be breached, it should be discussed first with the adolescent, who should be given the option to approach the topic with the guardian. Adolescent confidentiality regarding sensitive issues, including treatment for STD, mental health concern, substance use, should be protected. When transferring care, it is preferable to provide the medical record directly to the new provider rather than providing a copy to the parent. For adult, this is a very important point. Like for adolescent confidentiality, if you are trying to refer this patient, provide directly to the new provider, not provide a copy to the parent. Physicians are ethically obliged to protect against patients' confidentiality. Unless a patient is an active risk of harm to self or others, physicians cannot disclose information to family members without the patient's consent. Receiving medical collateral information, physician passively listen to concerned family or friend. Reciprocating information, physician sharing privileged information, concerned family or friend. Because vital details can influence the course of the treatment, physicians are allowed to receive collateral information from the concerned parties without obtaining patient's consent, particularly in emergency situations. However, the physician's role must be limited to passive listening, and the physician cannot reciprocate or engage in discussion of privileged information. The health Insurance Portability, the Health Insurance Portability and Accountability Act, HIPAA, protects health information by requiring verbal or written authorization verbal or written authorization for release of information. Hospital and physician offices frequently have additional policies requiring written forms for release of information and procedures to verify the identity of phone callers. It is important that healthcare providers be familiar with these rules and disclose only the minimum necessary information. HIPAA does not require the provider to obtain proof of identity of phone callers. Sending protected health information from a personal electronic mail. Sending protected health information from a personal electronic mail. Covered entities should only access or transmit electronic protected health information EPHI from a system that has technical safeguard to generate audit trails, access logs to identify all individuals who interact with EPHI, and prevent unauthorized access, password protection, automatic log-offs, encryption, secure networks. The transmission of PHI to or from a healthcare provider's personal electronic mail is a severe violation of the HIPAA. Personal electronic mail is a severe violation of HIPAA security rule and may even result in the healthcare provider being charged with data theft because primary it leaves PHI vulnerable to third parties. Other examples, HIPAA security rule violations include downloading PHI protected health information on an unauthorized device and leaving PHI in a place mm, accessible to third parties. These violations are likely to occur when healthcare providers interacts with mm, protected health protect So these violations are likely occur when healthcare providers interacts with PHI is an unsecured system at home to complete patient's note at work at a workstation that is accessible to patient discussing care with the colleague over texting application. The HIPAA security rule also requires covered entities to implement administrative safeguards, training personnel about HIPAA provision and physical safeguard, locking cabinets and data servers with PHI, primary filters, and computer screening to ensure that primary health information is generated, stored, and accessed, transmitted securely. Violation of HIPAA privacy security rule include releasing primary health information without patient's authorization after the expiry of the authorization, the limit, or to unauthorized individual. The exception to the requirement for patient's authorization include disclosure for treatment payment, claim reimbursement, and healthcare options, as well as disclosures mandated by law, notifiable disease, elder or child abuse, organ or body donation. In these cases, the degree of the closure must be limited based on minimum necessary standard. Okay. Reject the patient's request. Medical records are legal documents. The information provided should be complete and accurate and Intentional falsification of medical records may constitute misconduct, leads to a serious consequence for the physician, even if medical care provided was appropriate. Therefore, physicians should reject the request or reassure his records and treat confidentiality. Under HIPAA, patient can request changes their medical records if they consider them incomplete or inaccurate by placing a formal request to the covered entity. The covered entity should correct the medical record if the information is incomplete, inadequate. When making changes, a strike through a line drawn through the text should be applied to be written on electronic notes but still remain legible to avoid ambiguity. All amendments should be dated and signed by the covered entity. Okay, now the bad news reveal the spikes protocol. Okay, now spikes protocol set the stage, perception, invitation, knowledge, empathy, and summary and strategy. Set the stage, arrange for a private, comfortable setting, perception. Use open-ended question to assess the patient's family perception of the medical situation. Invitation ask patient family how much information they would like to know and remain cognizant. Cultural, educational, religious issue. Knowledge warn the patient family that serious news is coming. Speak in simple and straightforward terms. Empathy, express understanding, and give support when responding to emotion. And summary and strategies. Summarize and create a follow through plan and including end of life discussion if applicable. So Spikes protocol set the stage, perception, invitation, knowledge, empathy, and summary and strategy. When delivering bad news, a face-to-face visit in comfortable private setting is preferred the patient as it allows the physician to respond to a non-verbal aspects of communication and provide empathy, emotional support as needed. It is important to assess the patient's understanding the condition and how much the patient actually wants to know. Patient have the right to know and or to decline discussion of the diagnosis. When the patient declines, the physician should ask the patient to choose a family member with whom the diagnosis can be disclosed. Doing so ensures continuity of the information and should the patient choose to be informed later. Communication. Communication decisions about whether to accept gifts from patients include cost, type, timing of the gift, and the motivation behind giving it. Gifts should not be accepted from patients experiencing a mood episode, potentially affecting their judgment. Gifts that are extravagant, inappropriately intimate, or given a secure preferential treatment should not be given to secure preferential treatment should not be accepted. The patient's motivation is the most important factor to consider because it is unethical to accept gifts motivated by the desire to influence the physician's behavior or by exceptions or of preferential or special treatment. The most appropriate response is to express appreciation from the gesture but decline the gift and assure the benefit, he will continue to receive the same standard of care. Counseling of patient in clinical uncertainty, establish rapport, express concern, assess patient's knowledge and understanding the current fact, clearly state the level of the uncertainty, and plan of care, arrange follow-up or recommend plan to clarify the diagnosis test, specialty consultation, and establish shared decision making. Counseling of patient in the setting of clinical uncertainty should convey a potential seriousness and include individualized discussion, differential diagnosis based on facts. The degree of uncertainty should be acknowledged, and the discussion should also explain the need of further evaluation, include a clear plan for follow-up. Although the patient opportunity to ask question, I cannot accept your invitation because it would compromise your son's medical care. Third parties often make decisions affect the patient's health and welfare and are vulnerable to physicians' influence. Initiating a patient's relationship with a third party who is close to the patient, parent, spouse, and partner plays an integral role in the patient's medical decision making process and is therefore inappropriate as it can compromise treatment as well as autonomy, patient's privacy, patient with decision making capacity, legal competence. Such relationship can limit the physician objectivity, exploit the trust of the third party, and negatively affect the patient's well-being, which is why the invitation should be declined. While romantic or sexual relationship, while romantic or sexual relationship between physicians are current patients are always unethical. Physicians, excluding psychiatrists, may engage in romantic or sexual relationship with the patient in some if more than 1 to 2 years have passed since termination of the patient physician relationship. Psychiatrists in small position of influence over their patient and should never engage in relationship with current form. Okay. When communication with a large family system, it is often helpful to establish primary points to contact who is able to concisely communicate questions and concern to the care team. Use medical interpreters, either trained staff with training in interpreter ethics, skills, and medical terminology, or video conference or telephonic system to optimize the patient's comfort and physician's communication. Providers should directly address the patient rather than interpreter. Maintain frequent eye contact with the patient. Speak in short sentences, allow accurate translation. Provide translated written material, discharge or appointment summary directly to patient when possible. Such material should accompany, not substitute for active patient counseling. Having bilingual family member translate English material is not recommended due to potential for error. Minor children should not be asked to interpret or translate in non-emergency situation. Use patients teach back. in which describe the understanding of a treatment plan to provider asking this patient to describe how she will take her new medication. This technique confirms patient's understanding and allow clarification and miscommunicated information. Ad hoc interpretation, referring to temporary interpretation by non-qualified individuals, bilingual or partially fluent family members or medical staff, generally is not recommended due to error. However, ad hoc interpretation may be necessary in limited situations which may not the following. In the patient has urgent medical need, presenting with acute symptom, urgent care setting, appears ill, restless, coughing. Qualified interpreter services are not reasonably accessible. System is inoperable and preventing patient harm. Behavioral interventions is dietary improvement, dash diet, regular exercise more than 150 minutes per week, and disease prevention and risk factor management. Clinical role provides specific guidance, tailor counseling to the patient, and culturally preferred foods. Apply motivational interviewing, assist patient in the setting of focused goals. Smart goals. Smart goals means specific, measurable, attainable, or relevant, time-bound goal. Behavioral intervention for weight loss, stimulus control, maintain stocks of easy to prepare healthy food, store healthy food in prominent location, limit stock of less healthy foods, physical activity, moderate to intense aerobic exercise, resistance or strengthening lifestyle activity, take stairs, reduce sitting time, self-monitoring weight, food intake, exercise, and accountability, provider visit, phone calls, internet contact, group participation sessions. Food deserts are identified as low-income communities that have limited to healthy diet. When addressing to this barrier, communication should be non-judgmental to foster collaboration and develop practical treatment plan. Helpful information can found within USDA economic research of both food deserts and food and nutrition assistance program, which may help address by the financial burden. Okay, this is the second part of the ethics. So boring, I know. Hope you enjoyed.